Well, hello, and thanks for joining me. This is your host, Tim Elinski, Mayor of Cottonwood. This is Inside Cottonwood, and want to thank you all for watching today. We've got a hybrid show today. We've got April Rhodes, who's the CEO from Spectrum, with us virtually today. April, thanks for joining us. Really appreciate you taking the time out of your day. I know you are extremely busy these days, so I'm not quite sure how you were able to carve out the time, but thanks so much for being here.
Thank you, Mr. Mayor.
All right, so April, I wanted to talk, obviously, top of mind for everyone right now is the vaccination effort that Spectrum has taken on. And I want to get into that a little bit later in the program. But before we do, I kind of want to just take a step back and talk a little bit more about the history of Spectrum. I think, Spectrum had some very humble beginnings. I think back in the day, in the 60s, I don't know if anyone could have imagined that Spectrum now would be leading the charge in Yavapai County in vaccinating folks for the coronavirus. But that's, in fact, what happened. And it didn't really take long for Spectrum to get into that the position in our valley here to do so. But let's talk about the history of Spectrum. I hope you can share with us a little bit about their humble beginnings. They were known as the Verde Valley Guidance Clinic, I believe, back in the day. Can you share a little bit more about that?
Sure. Yeah, I think well documented in our history has been a lot of response to the community too. So as you said, I guess they probably didn't imagine then that this is what we'd be doing now, but it certainly makes sense when you look back over the history. So Spectrum actually started in a little house right across the street from the hospital there off of Willard. And this was back in 1965. We were founded as a small community behavioral health organization and really ran mostly off of donations and time volunteered from people in the valley. So we had psychologists, psychiatrists driving up from the valley and volunteering their time, with no real pay for that. And so a lot of the things in the house were furnished to us through donors in the community. There was money given each, like for the actual receptionist, people like that to run the office. But then it obviously over many years expanded to include the big facility up on the hill that most people are familiar with off of Cottonwood Street. That land was actually donated to us by a longtime board member who has since passed away, and his son, in fact, currently still serves on our board. That's Rob Olson, who is a local business owner in Sedona and Cottonwood. And so, just over the years with the advent of Medicaid in a big way, a lot of people don't realize that in Arizona was the last state to adopt Medicaid, and then like the first state to do it in this huge way through managed care organizations. And so as that came online, we were able to expand pretty significantly in the 90s into the organization we are today.
But getting back to those early days in the 60s, in the mid 60s, what were the services that Spectrum offered at that time? Or,
primarily at that time, yeah, it's under Verde Valley Guidance Clinic. Primarily they're offering just very basic psychiatry services to adults in the community. And again, like I said, they were funded mostly through donors, so there was no real pay source for that at that time. So people would come in. These were, probably our most complex members in Cottonwood at the time, and really only in Cottonwood, Sedona, kind of Camp Verde area. So it was somewhat difficult to actually get in. The need was far greater than what Verde Valley Guidance Clinic was able to support at the time.
And I understand this was really one of very few places in northern Arizona that was putting anything together like this. Is that correct?
Yes, correct. Actually, Verde Valley Guidance Clinic, now Spectrum, has the ability to claim being one of the first health homes in northern Arizona. A lot of the other health homes that followed were founded around the same time, more like 1967, 1968. But Verde Valley Guidance Clinic, being started in 1965, has the ability to claim being the first.
Fantastic, good. So let's talk a little bit more and get into more detail on this, the rebrand to Spectrum and sort of a new focus. I think it's very interesting how you really saw the need for more holistic care in the healthcare that you provide. So can you kind of talk a little bit more about what was the impetus for that change?
Sure. So again, Spectrum having this long history of being kind of on the forefront of healthcare and behavioral healthcare in particular. Back in 2009, we actually made the decision to start doing integrated care. So this was, basically the combining of physical health services with behavioral health services under one roof. And in 2009, there was some discussion about this happening, but it wasn't happening in any real expansive way in our state or our country. And so but what we noticed was that people living with serious mental illness in our communities were suffering disproportionately from physical health illnesses that were compounding whatever was going on for them on the behavioral health side. And so as we began to take note of that ongoing trend, we also recognized that we were not only well positioned to help those individuals care for their physical health needs, but really we felt quite responsible to do so. And so we started out with a very small population of about 99 people living with serious mental illness, and quickly found that we weren't going to be able to sustain that financially unless we expanded that physical health footprint even further beyond that. And so that kind of started in 2009, still under Verde Valley Guidance Clinic, but then in 2012, we acquired a local practice in Cottonwood Valley Medical Center, and we were able to expand even further that physical health footprint because that was only primary care services spanning children to adults, and then we were able to sustain that primary care focus a little further, and that's what started the efforts towards rebranding. We basically thought we needed to really show ourselves as more of a healthcare organization versus just behavioral health, so that people could begin to think of us as a one-stop shop, so to speak.
Mm-hmm. Great. And you've expanded your physical presence too in Yavapai County. Of course, started out here in Cottonwood and then expanded, I believe, to Sedona. You have a presence in Camp Verde as well, and recently over to Prescott. So can you talk a little bit more about that expansion?
Sure. Yeah. So we have our roots in Cottonwood, and so we'll always, that's where our headquarters are. That's where they'll remain. But certainly, as we have seen the really positive outcomes of providing physical health and behavioral health in one place, and having people have the ability to get same-day access, get lab work on site, get their pharmacy needs met on site, we felt that everybody in the county should really benefit from that, and most populations. So we didn't keep it confined to just people living with serious mental illness, and instead expanded it out to include all populations across all payers across the lifespan. And so we had some opportunities in Western Yavapai County over the last couple of years to expand our efforts, both on the mobile crisis front, as well as the physical health and behavioral health front in Western Yavapai County. And then obviously the unexpected pandemic gave us an opportunity to really serve the needs of the county as a whole and from the primary care perspective. So that certainly helped to put us on the map in a way.
Mm-hmm. Okay. You did mention the mobile crisis team. I want to talk about that after our first break in greater details. I think that's one of the fantastic programs that you guys have spearheaded here. But before we do that, April, take a minute and tell us how you came to Spectrum, please.
Okay. Let's see. How did that happen? So I think it was about 2012. Actually, I started at Spectrum it was Verde Valley Guidance Clinic still at the time, and I started as a child and family therapist. I was a new graduate from ASU with my master in advanced study in marriage and family therapy. And it was kind of like later in my career, I did everything backwards as an adult. I had children, got married, then went to school and got my master's degree. And so I had already had a career really in healthcare administration. I'd worked at Bradshaw Lab, which is a local lab that many people will know in Yavapai County. And then it was acquired by LabCorp. And so I just wanted to do something different. So I went and got my master's degree in marriage and family therapy. So I actually started as a child and family therapist, and then slowly moved up. Well, I wouldn't say slowly, it was actually kind of fast, but moved up rapidly over that next couple of years into basically the successor to my predecessor, who was the CEO of the organization for 15 years and as an employee for 25 years. So it was a somewhat unique development plan that helped me. We worked together for about a year, me as his deputy director and him as the CEO, for a transition. And then the rest is history. I've been in the role since 2015.
Super. All right. Well, we're lucky to have you.
Thank you.
April, we're going to take a quick break, just 1 minute, and folks viewing, please come back and join us. We're going to talk a little bit more about this mobile crisis team and talk about some of the other partnerships that Spectrum has forged here in the Verde Valley. So stick with us. Thanks.
This is Bruce Morrow, Transportation Manager for Cottonwood Area Transit. Remember, we cover the entire Verde Valley and Sedona. Cottonwood Area Transit has you covered wherever you want to ride in the Verde Valley, all day, every day. Take Cottonwood Area Transit through Clarkdale, Verde Village, and from 26 locations in Cottonwood. With Verde Links, it's a quick and easy trip to Sedona every day. Don't forget our connectors to Camp Verde. Visit cottonwoodaz.gov for Cottonwood Area Transit and take a seat. Let's go ride.
There are people who struggle with addiction and homelessness. Sometimes it may feel like there is nothing we can do to help.
But there is. You can make a tax-deductible donation and help those in need transition away from homelessness. When you give someone a handout, you could actually be supporting an addiction.
A better life starts with better health, especially for those living in the streets.
Support solutions, not addictions. You can make a difference. Visit cottonwoodcares.org.
Well, welcome back to Inside Cottonwood. I'm your host today, Mayor Tim Elinski, and with me is April Rhodes. She is the CEO of Spectrum, and we're very pleased to have her. I know she's busy these days, like we said, but she took the time out to have a conversation with us about kind of the history of Spectrum here in the Verde Valley. They did start in Cottonwood, as we learned. Started out as the Verde Valley Guidance Clinic, providing one of the only clinics in the area to provide any kind of healthcare services, and so they really were ahead of their time. April's been with Spectrum, I think, since 2012, I think is what you said, and 15 as the CEO. Yes. Before break, she just touched briefly on one of the services they provide, which is the mobile crisis team. So this is something Cottonwood has definitely utilized a lot through our first responders, and just an amazing program. So April, if you could just take some time to kind of talk about what precipitated this team coming together and what you guys have been doing here in the Valley, that'd be great.
Sure. I always love an opportunity to talk about mobile crisis. It was actually one of the first things that we put in place when I became CEO. And at the time, really, we had a crisis team, so to speak, but it was really like two people that would respond to the hospital. And so every single crisis, mental health crisis that might occur in the Verde Valley would be directed to go to Verde Valley Medical Center. So a lot of times, as you know, that would involve law enforcement, and law enforcement would respond to a scene. Somebody would be experiencing some sort of mental health crisis, and then they would have to drive them to, from wherever they were to Verde Valley Medical Center, or in some cases to jail. And both of those locations were really, closer or easier to get to than trying to do anything different. And so, when I came on as the CEO, it was one of the first things I identified as needing to be changed, because what was happening is those individuals who were having that happen were a lot of times Spectrum's members, and they were known to us, and we had a history with them. And we, again, I think that's the theme throughout the years, is that we felt well positioned to do something differently there and felt really responsible to do so. So we partnered with law enforcement right out of the gates. We got all 13 law enforcement agencies represented at the table and worked together to create a mobile crisis response for law enforcement by law enforcement. And that launched live in 2016, and it's been going ever since.
Mm-hmm. And it's, I believe the chief of police of the town of Clarkdale is on your board. Is he still a board member, president of your board?
Yes, that's correct. Yeah, he became a board member after Mobile Crisis got up and running, and we felt like it would be important to have a law enforcement presence on the board, and so we had reached out and asked him to join.
And what was the reception from the law enforcement community in the area? Were they eager to see a program like this come to fruition? Did they have any good feedback to give you? I mean, tell me a little bit more about that process.
Sure. Yeah, so we, initially we knew, we have experience working with law enforcement in general, and we knew that if we were going to ask them to use a different service, that it needed to work, because word spreads fast with law enforcement. And so if it didn't work once, then they just weren't going to use it. And so that was part of the reason that we brought them to the table from the beginning. And we said, we don't want to just create something that is based on what we know in the mental health field, but rather we want to invite you in to say, if we did create something that would be a better alternative to taking people to the hospital or jail, what would that look like? What components would it need to have? And they mentioned basically three things: that it needed to be 24/7 response. Obviously, it couldn't be just when we felt like it. If you're like law enforcement responds when you're called, so does mobile crisis need to. And it needed to cover all areas of the Verde Valley. And it needed to be timely. So it couldn't take us 2 hours to get there. We really needed to get there in 30 minutes or less. So we set those three things as our non-negotiables when we built the team, and we kind of tasked our our behavioral health teams to put together what that would look like. And so right from the beginning, we started out with that in mind. And part of, I think, what's made it so successful is that from the very beginning, I made myself personally available for law enforcement in real time, saying, like, if this doesn't work exactly how I've laid out, then I want you to call me and let me know that in real time. And then we had regular stakeholder meetings from the very beginning on a monthly basis that we still hold today, more quarterly. But we would get all of them together and say what worked, what didn't work, what can we do better? And they just really helped craft the team. So the reception was really very positive.
Super. And you've since expanded this over to the Prescott side as well.
Yes, correct. We were actually able to expand over with the help of a Blue Cross Blue Shield Mobilize AZ grant. And we partnered with Prescott PD to start with, and then expanded it out to respond to all law enforcement in Western Yavapai County. And then similar to the response that we built in the eastern side of the county, we started with response to law enforcement, and then we began getting calls immediately from the community. And so we expanded our teams to be able to support that demand. And now we take calls community wide from both sides of the mountain and still respond to law enforcement in real time.
Now you say you take calls from the community, so you don't just receive calls from police departments, but also from community members?
That's correct, yes. We'll get called directly. And that's really the idea. Actually, the law enforcement calls make up about 1/3 of our total call volume now. So the rest comes from either the local emergency departments or from the community at large, calling through a crisis response network, which has the hotline for the community in northern Arizona.
And April, can you give me a sense of how often your team is dispatched? Just for example, here in the Verde Valley, I mean, is it, do they stay pretty busy?
They certainly do. The Verde Valley is the busier side for sure. Again, that's where our roots are. And so that's where the majority of resources are focused. So they're responding to, on average, about 150 calls a month in the Verde Valley. Wow. Cottonwood makes up the bulk of that. The city of Cottonwood police and community make up the bulk of that. But we are responding to all areas of the county, really. So we're talking, Yarnell, Congress, Baghdad, like area, Black Canyon City at times. So we're taking calls from all over.
Wow. And your response time is, you try to keep it under 2 hours, isn't that correct?
We actually have an average response time of less than 30 minutes across the whole county.
Wow. Less than 30?
Yes.
Wow. That's impressive.
If it's normally around 10, 15 minutes. We have a couple outliers there that have made the average be closer to like 29 minutes because we've had a couple out in Yarnell or further areas where it takes some time. Wow,
good for you. That's impressive. All right. Well, again, I know we've utilized the service a lot here in Cottonwood, and we sure appreciate that partnership very much.
As do we. Thank you.
Certainly. And speaking of partnerships, there's a lot of other service organizations here in the Valley. I'm sure there's many in Prescott as well. You've been a great partner with some of these other agencies. Can you talk a little bit more about that?
Sure. I think Spectrum, again, just really sees ourselves as the healthcare partner and wants others to see us as that go-to partner as well. So we have many people reach out, and doesn't mean we're always able to meet the need, but we certainly do try. If we have like the school districts are a big partner of ours as we work to try to put behavioral health in schools across the county to have a good response time to meeting that need. Obviously, with kids not being in school, that's looked a little differently, and we're certainly very concerned about the impact on children not in schools. And so, we've just tried to partner with providing, whether it's COVID testing, whether it's the vaccinations, mobile crisis response, real-time behavioral health response in the community, getting people in for their well checks on a more regular basis. Our goal really is to make primary care and physical health, behavioral health as much a part of the conversation as primary care and physical health, because that's what we'll get at reducing the stigma. So the more that we can be there to help and support our community partners in real time, we think the better we'll do on achieving that goal.
Fantastic. All right, April, we're going to take another quick break here, just 1 minute, folks. When we get back, we're going to talk a little bit more about COVID response and how that's kind of altered the services that Spectrum's provided, as well as them leading the charge here in Yavapai County, really, for vaccination efforts. So please stick around. We'll be back in 1 minute. Thanks.
This is Bruce Morrow, Transportation Manager for Cottonwood Area Transit. Remember, we cover the entire Verde Valley and Sedona. Cottonwood Area Transit has you covered wherever you want to ride in the Verde Valley, all day, every day. Take Cottonwood Area Transit through Clarkdale, Verde Village, and from 26 locations in Cottonwood. With Verde Links, it's a quick and easy trip to Sedona every day. Don't forget our connectors to Camp Verde. Visit cottonwoodaz.gov for Cottonwood Area Transit and take a seat. Let's go ride.
There are people who struggle with addiction and homelessness. Sometimes it may feel like there is nothing we can do to help.
But there is. You can make a tax-deductible donation and help those in need transition away from homelessness. When you give someone a handout, you could actually be supporting an addiction.
A better life starts with better health, especially for those living in the streets.
Support solutions, not addictions. You can make a difference. Visit cottonwoodcares.org.
Welcome back, friends. This is Inside Cottonwood. I'm your host today, Mayor Tim Elinski, and with me is April Rhodes. She's the CEO of Spectrum, and we're very lucky to have her here with us today. She shed a lot of light on some of the programs that Spectrum offers here, leaders really in integrated healthcare here in the Valley and in Northern Arizona. And I want to talk a little bit, April, about we're almost a year into this pandemic, showing its ugly face here in Arizona. We're coming up on March here real quick, and it's been a year. So what happened? How has Spectrum been, how have you had to modify the services that you provide with all these challenges presented by COVID?
Well, you know, it's certainly been interesting. We've had to be creative. What one benefit was that prior to the pandemic, Spectrum was already providing some services via telemedicine. And again, you know, it's one of those things that for us was like a no-brainer. You know, you can really meet those access to care demands by providing virtual care. And so we had kind of dipped our toe into the telemedicine pool. So when the pandemic came, you know, when it hit in real force, we were able to just scale up that telemedicine delivery. And we had to do so in an incredible way. I mean, I think we moved from about 25% telemedicine services to about 45% for a while there, which actually isn't as much as a lot of behavioral health organizations had to do, where they've moved to like 85%. And so because we have such a big physical health presence, we moved about that 45%. We kept physical health in person primarily, but we also pivoted to provide curbside care. You know, we began to recognize pretty early on that people were obviously uncomfortable going into even their providers' offices to get their basic healthcare needs met. And so we were concerned about what that impact would be. And we wanted to make sure people would still, you know, those who couldn't access services via their phone or a tablet, they could come to the curb at all of our sites and be able to still access a provider in real time from the comfort of their car. So we launched our hashtag Meet You at the Curb and curbside care campaigns. Mm-hmm. And that was, you know, kind of the impetus to a lot of the COVID testing as well, because people wanted that curbside.
Sure. Obviously, with the pandemic and folks needing to isolate at home, I'm sure that you've had to deal with some of the mental health challenges that accompany just the sheer isolation. How is that? How have you faced that challenge?
Well, you know, we've seen it play out in the numbers. We track a lot of data for our mobile crisis teams, and we saw, I mean, almost going back to immediately following the pandemic, a spike in alcohol-related calls, you know, substance use-related calls, people feeling increased depression, loneliness, things like that. Our mobile crisis teams are responding to. That's certainly been the case as people reach out to us for their behavioral health services. A lot more people reaching out, you know, from like commercial insurance, things like that, to meet the need for their members virtually for things like just depression or generalized anxiety, things like that. And then with primary care, you know, the sole focus has been on getting COVID testing or COVID vaccinations to the exclusion of managing a lot of their regular ongoing needs, healthcare needs. So, you know, we've continued to see that impact play out in a way that's concerning for us.
Mm. Okay. Well, let's focus our last 5 minutes here on the light at the end of the tunnel, the vaccination effort. And you've really taken the charge. And why Spectrum?
Well, that is an excellent question. You know, I definitely didn't necessarily predict that Spectrum would be at the forefront of vaccination clinics. I think, like a lot of people, we thought that there was, some sort of system or mechanism, like a public health mechanism in place that gets activated when things like this happen. And which is true, the local health department's been really instrumental in helping us launch our vaccination stations. But that system is really calling on the providers locally to do that. That is, where they've turned. And so as we, we certainly knew we'd play a role in vaccinations. We would provide the vaccine to anybody who wanted it in the community that was seeing us, similar to COVID testing. But I think, we were not certain that we would be the ones doing these massive pods, but the health department asked, for our help. And we certainly saw again in the community that we were well positioned to do that and responsible, really. As you mentioned, it represents the light at the end of the tunnel for a lot of people and for us. And so we just decided to scale up those efforts. We were already doing kind of small vaccine clinics, and we realized that logistically we could do something better and bigger and get to a bigger part of the community if we were to rapidly bring that online. So we just set about doing that.
Mm-hmm. You're so humble. I think go big or go home, right? I mean, you guys didn't just set about doing it. You've been extremely successful. I've had the pleasure of going to your vaccine clinic, and it was like a well-oiled machine. I mean, it was just amazing. You had a ton of volunteers, a lot of very skilled, trained staff available. Frankly, I was just impressed that you were able to build that up so quickly. Really a great effort.
You. Yeah, it has been a monumental team effort. I want to say, the team at Spectrum we just couldn't do it without this huge team of people that came together to make it happen. I think there's about 10 days prior to go live that, there's like a team of 4 of us that were just really pulling it together, getting the pieces in place, the logistics, all of that. But then once we announced to the larger team, they just made it happen. And then we had overwhelming response from the community in terms of volunteering. We have FEMA on site. We have National Forest Service on site now helping us. And so, it is we haven't done it alone. That's for sure.
Yeah, again, a lot of folks there, and I've never seen so many people so happy to get a shot in the arm. Everybody was just so darn happy, and the staff and the volunteers that were there. It was a really just great experience to see that come together. So I know it's a team effort, but certainly you led the charge, and we really, really appreciate that here in the Valley.
Well, thank you.
Yep. And you're doing the same
really
again.
Our pleasure.
You're doing the same over in Prescott as well, aren't you?
Yes, correct.
Yep.
So we have the Findlay Toyota Event Center over in Prescott, which is set up to be a pretty large operation as well.
Mm-hmm. Great. And so then I see a number there on the bottom of the screen. So for more information, folks can call that number, right, to get themselves scheduled. You want to talk a little bit about that?
Yes, so scheduling has been probably the largest challenge with all of this because of the sheer volume of people, the intense public interest in this particular subject. We didn't have the infrastructure set up to take the number of calls. There's so many people, and particularly in this phase 1B population that we're in of 65 and older, that may be more accustomed or prefer to pick up the phone and call and talk to somebody. We've had to rapidly ramp up. We're in fact using some of our volunteers to staff a pop-up call center to manage that volume of calls, because the interest and the link on the website broke the internet for us in the beginning. And so we weren't able to keep our servers, and even though we have servers hosted on Google, we weren't able to necessarily keep it all running smoothly. And so we've tried really hard to accommodate that call volume. People can call. We don't have open appointments right now. We're still trying to catch up from last week where we had to cancel, or not cancel, but postpone a lot of appointments because of the shipping delays. So right now, the call center is answering calls from people who had existing appointments, trying to figure out when they're coming in, since all of last week got wiped out essentially. So our call center is up, it's running, and there is a phone number that I can find. I'm sure you have it too, because we've had some press releases, but people can call and get help with their existing appointments. And when we are able to open up new appointments, then we'll release that information to the public as well. Great.
Well, I think it's great you're taking both call and online appointments. Is that correct?
That is correct.
Yeah, and the calling is important for a lot of folks that just don't have access to a computer or can't navigate a website like me and are challenged in that way. So really, again, appreciate you taking all that into consideration. I think you had a goal of inoculating 500 folks a day. Let's talk about how you've done.
Well, our goals really to start were more like 2,000 per day, but based on vaccine supply, we've had to pare that back considerably to about 500 per day per site. We have certainly far surpassed that. We have done over 19,000 vaccinations countywide, with about 8,300 of those being in the Verde Valley. Keep in mind that the population center, obviously the larger part of the population is in Western Yavapai County, but we also have help over there with YRMC doing some of their vaccinations per day. And the eastern side, we're really it. And so we're operating out of Verde Valley Christian Church, which we're really shooting to have 600, 700 people per day, being seen out of there. But because of the vaccine supply, we've been around 450, 500. The capacity for that site is about 1,000.
Mm-hmm. Great. Well, hopefully if supply chain gets you some more product, then you can get it in more arms and further your efforts. But really a monumental task, very well handled. Really appreciate your efforts in that front. And it is light at the end of the tunnel. I mean, it's been a long year for a lot of folks, and we really see this as a chance to get coronavirus behind us, kick off 2021 in a more positive fashion, and get back to life as we used to know it, right?
Yes, for sure.
Yeah. All right, well, April, we're out of time. I think we could talk for a lot longer about all the things that you've done here in the Valley and beyond. And again, I know you're very busy. Really appreciate you taking the time. I think your former board member, Mr. Olson, would be very proud to see that so many decades later, you guys are leading the charge on the vaccination front. When who could believe in that little small building that you used to be in across from the hospital that you'd be doing this today? But really, great effort, good teamwork. Appreciate your time, April, and appreciate the folks at home viewing. And we'll see you next month. This has been Inside Cottonwood. Again, I'm your host, Tim Elinski, and with me today was April Rhodes, the CEO from Spectrum. Take care.